Welcome to a journey through one of history's most brutal and terrifying medical practices. Ancient Greek surgery was a nightmare made flesh, and you're about to discover why patients often begged for death rather than face the surgeon's knife. If you're fascinated by the darker corners of medical history, hit that subscribe button so you don't miss our deep dives into how far we've come. Let's start with the most obvious problem. Ancient Greek surgeons had absolutely no anesthesia. When a patient arrived at the surgical theater, they knew exactly what awaited them. There would be pain, unbearable, all-consuming pain that would last for hours. The surgeons understood this perfectly well, but they had no solution. Wine was sometimes offered, maybe a little opium if the patient was fortunate, but these barely dulled the agony that was about to unfold. Imagine lying on a wooden table, fully conscious, while a surgeon prepares to amputate your gangrenous leg. You can see his bronze instruments gleaming in the Mediterranean sunlight. You can smell the oil lamps burning in the surgical chamber. You know what's coming, and there's nothing you can do to stop it. This was the reality for countless Greeks. The instruments themselves were crude by any modern standard. Surgeons used bronze saws, iron knives, and bronze probes. These tools weren't sterilized in any meaningful way. The concept of germ theory wouldn't exist for another 2,000 years. Surgeons would wipe their instruments on cloth or dip them in wine, believing this was sufficient preparation. In reality, they were transferring bacteria and infection from one patient to the next, essentially guaranteeing sepsis and death. One of the most common procedures was the removal of bladder stones. These are absolutely agonizing to develop, and the only known cure was surgical removal. The procedure involved making an incision in the perineum, then probing blindly into the bladder. The surgeon had to locate and extract the stone without being able to see inside the body. Imagine the precision required, and imagine doing it without anesthesia, while the patient thrashes in unimaginable agony on the surgical table. The Hippocratic corpus, the foundational text of Greek medicine, actually describes this procedure in detail. These medical writings reveal that Greek surgeons understood anatomy reasonably well for their time. They knew where organs were located. They understood that certain procedures were necessary to save lives. But understanding anatomy and being able to operate safely are two entirely different things. Cauterization was another favorite technique surgeons employed. Surgeons would heat iron instruments until they glowed red or white, then apply them directly to wounds. This was done to stop bleeding and prevent infection. And in some cases, it actually worked for those specific purposes. But the agony was indescribable. The smell of burning flesh filled the surgical chamber as the patient screamed. Many surgeons noted that patients would lose consciousness from the pain, which was sometimes a mercy. The aftermath of surgery was equally horrifying. There was also the matter of infection. Even if a patient survived the surgery itself, infection was almost inevitable. Wounds were treated with bandages made of linen or wool, soaked in oil and wine, and left open to air and dust. Surgeons had no understanding of how infection spread. They attributed it to bad air, to imbalances in the body's humors, to the will of the gods. In reality, they were allowing deadly infections to flourish unchecked. Amputation was relatively common in ancient Greece, particularly for soldiers with severe battle wounds. A gangrenous limb had to be removed or the patient would die from the spreading infection. So a surgeon would tie off the limb with cord. The cord would minimize bleeding. Then the surgeon used a saw to cut through bone, while the patient was held down by multiple assistants. The speed of the surgeon mattered immensely. The faster you could cut, the less blood loss. Some surgeons could amputate a leg in under 3 minutes. This was considered impressive skill. But speed came at a cost. Speed meant less precision. Speed meant ragged edges and splintered bone. Tissue damage that would take months to heal would occur, if healing happened at all. Many amputees developed infections at the stump. Many others simply died from blood loss or shock during the procedure itself. The ancient Greeks did develop some successful surgical techniques, and we should acknowledge that. Trepanation, the practice of drilling or scraping holes into the skull, was performed for thousands of years, and some patients actually survived. Some patients lived for years afterward. Surgeons could treat some external wounds, remove some tumors, and reduce dislocations. But success was never guaranteed, and the process of getting there was pure agony. One particular challenge was internal bleeding. If you were injured in a way that caused bleeding inside your body, you were essentially finished. Surgeons had no way to access the bleeding, no way to see what was happening inside you. They had no way to stop it. They could only watch as patients grew weaker and paler, fading away over days or weeks. Some historians suggest that internal injuries were considered a death sentence by both doctors and patients alike. The psychological toll on patients was enormous. You would hear stories of others who had undergone surgery. You would know the risks. You would know the pain that awaited you. And yet sometimes surgery was still the better option. Sometimes surgery offered hope against slow death from infection or cancer. This created an impossible choice: undergo excruciating surgery that might kill you, or refuse it and die slowly and painfully from your underlying condition. Greek surgeons did make attempts to manage pain. As mentioned, wine was offered, and opium was sometimes available to wealthy patients. Some surgeons used cold water immersion to numb limbs before amputation. Some used a technique called the cord tourniquet. This could reduce sensation in the limb being operated on. But none of these methods were truly effective. The patient's experience never improved substantially. There was also the matter of skill variation. Not all Greek surgeons were equally competent. Some were trained carefully under master surgeons. Others were essentially self-taught, learning through trial and error on their patients. A skilled surgeon might be able to extract a bladder stone with minimal tissue damage. An unskilled one might spend hours probing blindly, causing massive internal injuries in the process. Survival depended on who you could afford to hire. The infection problem was compounded by the fact that surgeons often operated on multiple patients in quick succession. They might perform an amputation in the morning, then immediately move on to treating a wound without proper cleaning. The same instruments would be used, carrying bacteria from patient to patient. Cross-contamination was rampant, though no one understood that's what was happening. Sepsis, or blood poisoning, was the great killer in the aftermath. A patient might survive the operation itself, only to die days or weeks later as infections spread through their body. Fever would develop, followed by delirium and eventually death. Surgeons attributed this to various supernatural causes. They didn't realize they were the ones causing the fatal infections through their unsterilized instruments and techniques. Greek surgeons did keep records of their cases, and these records reveal a sobering truth about survival rates. Survival rates were terrible by modern standards. For major surgeries like amputations, perhaps 30 to 40% of patients survived long enough to leave the surgical chamber. Of those, maybe half survived the inevitable infection that followed. So overall, perhaps 15 to 20% of major surgery patients actually recovered. These are probably generous estimates. Some sources suggest survival rates were even lower than that figure. A patient undergoing amputation had less than a 1 in 5 chance of living through the experience and actually recovering. Those aren't odds that inspire confidence in any thinking person. The pain management situation was so dire. Some surgeons actually had to knock patients unconscious. They would strangle them briefly, or use a technique called carotid compression, where they would apply pressure to the neck to reduce blood flow to the brain. The patient would lose consciousness for a few minutes, providing a brief window of time to perform emergency procedures. When the patient woke up, the surgery might be partially complete, but the pain would come roaring back. There were also cases of patients requesting that they be allowed to die rather than undergo surgery. These requests were sometimes granted, as surgeons recognized that a patient's will to survive was crucial to recovery. If you didn't want to fight through the agony, you were probably going to die anyway, with or without surgery. So some patients simply chose to refuse treatment and accept their fate. Wound treatment after surgery was equally problematic. Surgeons used various substances to promote healing, including honey, which actually had some antibacterial properties and worked better than most alternatives. But they also used things like boiled pitch, animal fat, and various herbs. These had no real medicinal value. The bandages themselves were often dirty, reused multiple times, and changed infrequently. The concept of sterility was completely absent from ancient Greek surgical practice. A surgeon might operate in the same clothes he wore all day. His hands might not be washed before or after surgery. The surgical chamber might be in a corner of a temple or a market stall, exposed to dust and flies. Infection wasn't a risk factor to be managed. It was an inevitability that was simply accepted as part of the process. Yet despite all these horrors, Greek surgery did evolve and improve over time. Later Greek surgeons, particularly those influenced by the work of Galen in the Roman period, developed better techniques and better understanding of anatomy. But even these improvements couldn't overcome fundamental limitations. Operating without anesthesia, without antibiotics, and without a true understanding of infection were problems that couldn't be solved with better technique alone. The ethical implications are worth considering. Greek surgeons knew their patients would suffer terribly. They knew many would die from infection. And yet they continued to operate because the alternative in many cases was worse than surgery itself. A patient with a gangrenous limb would die if the limb wasn't removed. A patient with a bladder stone would face lifelong agony and eventual death. So surgery, terrible as it was, sometimes offered the only hope. This is why ancient Greek surgery made patients wish for death. Not because the surgeons were careless or cruel, though some certainly were. It was because the fundamental tools and knowledge didn't exist yet. Anesthesia wouldn't be developed for another 2,000 years. Antibiotics wouldn't exist for another 23 centuries. Germ theory was thousands of years away. Surgeons were operating in a medical dark age.